Welcome back. Well, we are discussing oral health today on the Medicine Box. Well, Dr. Pradhan, I'm going to ask you about how important is it to have aligned teeth and what should one do?
Again, aligned teeth are not just for cosmetic reasons. They're also for functional reasons. As I said before, if your teeth, the way they meet, what we call occlusion, is not proper, it can lead to other damage to the joints, to the gums. We have bone loss around the teeth. So there are other things that can happen. So alignment, people have this misconception that alignment is a cosmetic treatment. It's not only a cosmetic. Of course, it can also be a cosmetic treatment, but it is also a very functional treatment, and alignment is extremely important.
Okay, so can you do that at any stage in life, and how would it be? Would it only be via braces?
Yes, it's mainly via braces, alignment of the teeth. Cosmetically, we can use veneers and stuff, and that's a different issue. But alignment is by, and today we have invisible braces, so to say, which are more digitally orientated, and we have algos which give us the final result before we start, and so those are called aligners. So we have aligner therapy, which will enhance at any age.
Okay. Well, Dr. Sunil, what would you recommend to somebody who has lost their teeth?
If I could replace any missing tooth as a dentist, it would be with an implant.
Yeah.
Because an implant, which is a screw-like structure made of titanium in most cases, goes into the bone after you analyze the height and the width of bone available. It then takes a permanent tooth as a replacement on it, and it allows somebody to function most normally, rather than do something else which will either involve support from the gum, or you have to grind down an adjacent tooth and make something like a bridge, which is again, in my opinion, not as it is a little bit more mutilating compared to just doing an implant, which will reinstate a tooth for what it is.
Okay. But is it necessary to replace a tooth?
It is 100% necessary to replace a tooth. We were just discussing earlier about tooth alignment, right? When you do, what aligners or braces does is changes root positions in the jaw. When you change root positions, you support your jaw bones better, and your youthful look and your entire projection of your face is far more positive than if you have to just change the position of the crowns with veneers, etc. You know what I mean?
Yeah.
Because your bones are filled with roots now.
Yeah.
And to answer your question, yes, aligners will help you and will reposition all the teeth, but to some extent, braces will be the whole full Monty.
Okay. What is probably the most common cosmetic dental procedure which is currently underway, and how safe or unsafe is it?
The most common procedure that I think all of us, Suchetan, I'm sure will agree with me, which we do in our offices to please somebody. You're not always working on all teeth, you're working on some, or maybe a couple of them. The most common procedure is bonding, because you take materials from your rack, you treat the tooth in a specific way, and you apply the material to effect a correction or repair the tooth or do a cosmetic filling where it's very visible. And that bonding can be done simply in a few minutes. Only when the bonding procedure cannot be effected, you think of the next thing. Like, instead of a bullet, you use a cannonball now. You know what? You're using a crown, or you may use a veneer sometimes.
Okay, but what are the long-term implications of it is what I mean.
No, it has to be carefully planned. You can't, function always comes before aesthetics. That means you have to evaluate that the function is going to be properly fulfilled. The client is not going to be left with a disadvantage like sensitivity or TMJ problem or something, and then you plan the teeth, you put it on an artificial articulator, you tell the lab to make sure everything's in balance, and then do it.
Okay. Well, Dr. Pradhan, oral health, how indicative is it for other diseases, say such as diabetes, HIV, arthritis, osteoporosis, and yes, oral cancer as well?
So it's not, you can't really diagnose, say, I can't say this is diabetic, this person is diabetic just by looking at the teeth.
But a red flag.
Yeah, so something is wrong. There's a massive red flag there, and a lot of other issues, acidity, for example, like we said, it's a continuous, the oral cavity with the gut, and that's a microbiome. Today, everybody is talking about it, and it's true. So we can see that something is wrong. Oral cancer, of course, is very obvious because you have lesions that happen in the mouth. And those we'll have to biopsy and check. And other ones we can suspect, and therefore we can investigate further and come to a conclusion.
So what would a red flag be for, say, a layperson who is monitoring their oral health?
So it's not just the teeth, it's also the gums. So you look at the gums, the color of the gums. You're looking at the mucosa and the rest of the oral, the cheeks, the tongue. You can see all the way up to the tonsils. So you can see all of those areas. So anything which is inflamed, anything which has ulcerations, those will be red flags.
Okay. And when it comes to oral cancer, what has your experience been? How successful is probably reconstructive surgery? Do we see a lot of oral lesions in, say, the urban population?
I mean, that's one of our biggest problems, isn't it? Because of what we eat, the tobacco products, and also these pan parags or whatever, the trade names that they have, the different trade names. And long-term effects of those starts with submucous fibrosis, then goes into leukoplakic patches, and then goes into full-blown cancer. So if they come to us regularly, we can monitor it and we can tell them, there's a red flag now, you better be careful. If not, if it goes into full-blown cancer, we have some of the best oral cancer surgeons in this country. And because of the prevalence of the disease, because of the very common prevalence of the disease, we have very good surgeons who are doing great reconstructive surgery in the city and in the country.
Okay. All right. Well, we're going to end this conversation by asking a couple of rapid fire questions. Dr. Pradhan, I'm going to start with you. How often should one visit a dentist?
Every 6 months, and if need be, every 3 months.
Okay. And what should one do after every meal?
At least rinse your mouth. That is the easiest thing to do socially and otherwise.
Okay. Well, Dr. Pradhan, should one use mouthwash? Does it corrode enamel? And if so, how often should it be used and how should it be used?
Mouthwash is very controversial at this point. Alcohol-based mouthwashes should not be used. Rather than that, you can use oral hygiene tools like water picks and things like that, flossing of course, which will help you maintain your oral health.
Okay, so you would recommend not using over-the-counter mouthwashes?
Not alcohol-based mouthwashes.
Okay, all right.
Natural mouthwashes are good.
Okay, all right. And what would a natural mouthwash be?
Which does not contain anything which is chemical or alcohol-based.
Okay, all right. Dr. Pradhan, what are the signs of gum disease?
Bleeding, bad breath, and bad taste in your mouth.
Okay. Dr. Sunil, are dental x-rays safe?
Yes, absolutely safe. They're low in dosage. Of course, everything has a limit. You can't make them in the hundreds on a client, but you don't ever need to. They're absolutely safe. Even the scan machines we have today, like I have a CAT scan machine in my clinic, it's very low in dose, so there's no problem.
Okay.
And if there's a pregnant woman or something, we wear a lead apron.
Okay. All right. Dr. Pradhan, how can one protect their teeth from damage?
Good oral hygiene and going to the dentist regularly,
Okay.
at least twice a day brushing.
All right. Dr. Sunil, best toothpaste and toothbrush to use?
A toothpaste is basically chosen for flavor globally. Use a over-the-counter toothpaste. Don't use a country-made toothpaste. Use a soft brush. Destroy your brush. Don't destroy your teeth. Brush in a vertical or elliptical motion, not horizontal.
Okay. And electric toothbrushes or normal?
When somebody cannot keep scrupulous oral hygiene by using a normal toothbrush is when one suggests, oh, they have a disability or they, cannot move their hands properly. That's when I would recommend an electric toothbrush. Otherwise, I would much recommend brushing manually and looking after your teeth. We were talking about tobacco and supari in a certain part of our clip.
Yeah.
I often tell my clients, addiction is something that is very easy to brush off, but not easy to give something up.
Yeah.
So if you want to have tobacco, don't pouch it in your mouth, don't keep it there, have it and finish it in 2 or 3 minutes. And supari, you are at the mercy of God because supari is extremely, extremely bad in terms of breaking your teeth down. The number one cause of tooth breakage in India is supari. Number one cause in the West is ice.
And what about smoking?
Smoking will damage your lungs, it will stain your teeth, it will make them dark grey, blue, and often you can clean it up, but the damage is more inflicted in your respiratory system, your lungs.
And what is the worst thing you could do for your teeth?
The worst thing?
Yeah.
There's a lot of people who eat pan and keep it in their mouth, and that
That's
orange stain gets into the tooth, and they become unsightly to a point where even tooth whitening won't take it away.
Okay, all right. Dr. Pradhan, Dr. Sunil, it's been a pleasure to listen to all of your insights on oral health. A lot to learn and a lot more to delve into further as well. Thanks very much for taking the time out and speaking with us.
Thank you, Ekta. Thank you very much.